This is a discussion of the difference between a side bending mobilization or manipulation of the thoracic joints and a rotational mobilization of the thoracic joints, and then a conversation about the joints between the thoracic vertebrae and the back of the ribs. Typical orientation of the facet joint of the thoracic vertebrae, right here, is at an angle between 30 and 45 degrees, similar to roof shingles. And I'll show you that on the spine model as well. Be a little bit easier to see. So the cervical spine has 7 vertebrae, and then the thoracic has 12. And the thoracics are known for having a rib attaching to them. And the rib attaches to the front of the transverse process, and then also will butt up against the disc and 1 or 2 of the vertebral bodies. It changes by level. And the joint is right here, and so it's laying at a 30 to 45 degree angle. Okay, well, typical techniques for mobilizing the thoracic is this corkscrew maneuver like that, okay? And then there's also a technique where the person lays on their back, folds their arms on their chest, and you bring them up in flexion and you identify the segment. And you also can do a mobility eval at the same time, and then it's often thrusted this way. Most of the correction with that is side bending. It corrects a side bending restriction. Now sometimes it'll correct a rotational problem, but perhaps due to anatomical variations, there are times when that does not correct a rotational mobility restriction. And so you'll know that the mobility restriction is being evaluated when the clinician puts their thumbs on the outside of the spinous process and tests in this direction, okay? Whereas the other mobility assessment might be done on the transverse process, okay? So let's imagine that this segment was stuck in right rotation, then as I walk down and test mobility, it would be prominent towards me and it would be stuck. And the one below it would have mobility, perhaps a little bit restricted, but I would be able to spring it, but this one would definitely spring. And then when I came on the other side, they would all have mobility, and I would actually be able to spring it further into the pattern in which it was rotated. And the technique that I choose to use, I'm not aware of anybody else using this technique, is I have the person side bend their body above and below, okay? And then I not only push on the segment that was restricted, but I also capture the one above and the one below, and so the direction of force is like this. And I maintain that for 2 minutes. And so it looks like this. Okay? And typically it's a one-time correction, does not require repeat treatment. And so that's a demonstration of the treatment for a rotational restriction in the thoracic spine. And typically that happens either at the first thoracic segment, right below the cervical spine, and that one articulates with the first rib, or it'll be in between the shoulder blades. You almost never see a rotational restriction below T5. Okay, and then the ribs come and form a joint, as I already showed, okay? And so the mobility testing that I do for the ribs is that I spring them away from the spine, and they should all be able to have a little bit of spring mobility, and I push to a stop point, and then I add a little bit of thrust, okay? And then I also test going medially, going towards the spine, and I do that test at about a 45-degree angle. And if that motion is restricted, then I alter my approach. If the rib appears to be rotated outward, okay, then my goal is to get it to go back inward. And that's the most typical way. There are a couple of other ways, but the most of the time when you're restoring mobility in the rib joint, I gap it forward towards the floor. Patient is laying on their stomach, and I gap the rib straight forward for about 30 seconds. Then I change my angle to about between 30 and 45 degree angle, whatever angle I can feel a little bit of give, and I maintain that force for 2 minutes. And that's usually a one-time treatment. The first rib I treat differently, so you can look at a different video. Just type in my last name and then first rib. And my last name is spelled H-E-S like Sam, C-H, and you can find those on YouTube. So I hope this is informative in demonstrating the difference between a side bending manipulation and a rotational mobilization, and also an introduction to the rib joints.